Good morning and welcome to the Point. In Lansing, there is an uneasy sense of normal. The state budget is done, but there are many members as well as the governor that might like to see that imperfect spending plan amended. So far, no deal. In the meantime, legislators are left to pursue their priorities by pushing bills and even packages of bills that they think can bring about needed change. One such lawmaker is Representative John Hoadley, a Democrat from Kalamazoo, focusing on prescription drug cost. Representative, it is interesting that you and a number of members are dealing with the cost of prescription medicine, because that has been identified as one of the biggest drivers in the cost of delivering health care across the nation, and you're trying to deal with it at least on a statewide basis. Talk to me about this package of bills and what you hope, which by the way is the acronym for this package, what you hope that this would achieve.
So the HOPE package, the Health Over Profits for Everyone package, was a group of bills and resolutions that were introduced by the House Democratic Caucus. And the goal of this is really simple. We want to make sure that folks are accessing the care that they need at an affordable price. Right now, the country is having a conversation about healthcare. We want to make sure that people get the care they need and they can actually afford it. And so some of the key provisions of the HOPE package are related to prescription drug pricing. When it comes to things like EpiPens or insulin, we should be able to make sure those are affordable for everybody or free, because they are critical and life-saving. Especially when it comes to something like insulin. I mean, this was an invention that was basically given away to the world. And what used to cost pennies to produce, now people are being charged $300, $400, $700 a month for access to insulin. That's wrong. And so part of the package would deal with those issues. We also have provisions that would crack down on the price gouging aspect. So we know that as the pharmaceutical benefits that are offered change, as new drugs or new drug pricing comes on the market, we want to have someone be standing up there for consumers. And so they are keeping more of the money in their pocket and still getting the health care they need. The last thing I just note about this, though, is we think it's time that when it comes to things like copays, that no one should have unaffordable copays. So we would limit primary care physician copays to $5, access to behavioral health services copays to $5. These are some of the common sense things that we can do. There's some other structural change that we need in this as well. That's why we have bills that would say, if you can safely re-import a drug from Canada, let's let that be an option on the table. If we have 282 drugs that are in critical shortage, let's make sure that we do something about that. Or my bill in the package that would say, let's give the federal government, Medicare, the ability to actually negotiate directly with the pharmaceutical companies to get lower prices and save the taxpayers some money. It's a comprehensive package, but we definitely need big reform.
Well, let me start with the last part, that part that would allow Medicare to work with drug companies to negotiate a price. That's not fully within your purview.
That's right. So mine is a resolution calling on Congress to take those actions. And it dovetails with the debate that we're seeing in DC right now. There's been some innovation at the state level or other purchasing agreements. The question is, why do we give a sweetheart deal so Medicare, which is one of the largest purchasers, couldn't negotiate lower prices and save taxpayers money? I mean, here's the reality. Prescription drug prices continue to increase significantly faster than the rate of inflation, and they're one of the largest drivers as we see costs of healthcare going up. And so when you've got something like Medicare, who is purchasing, one of the largest purchasing behemoths in the country that's driving these decisions, then why can't they negotiate with both hands instead of having one tied behind their back or not at all? So we can save some money and help some people get more care.
You said at the beginning you would like to make some of these critical drugs, and you mentioned insulin and EpiPens, and we know that a lot of people are using both of those, and you would like to make them low cost or free. There has to be a cost associated with the production of those. So if you were to make them free, would there be some type of a program through the government that would at least cover the cost of production?
Absolutely. We have to make sure that the state is paying for, or our insurance plans are paying for these prescriptions. I mean, that happens in a number of cases, and we negotiate those prices all the time. What's true, though, is that insulin hasn't become more expensive to produce. We should expect drug prices to go down over time. And so when we've created in DC and at the state level a regulatory environment that lets people profiteer off of our health, that is clearly saying that we've abandoned our ability to protect the health and welfare of the people of our state and our country. We have to fix this. And that's why, this package is a part of that. Of course it calls out some of the most high use prescriptions that we've been hearing the most about in the news, but it sets up that framework to let us continue to come back, because today we're talking about EpiPens and insulin, and tomorrow it's going to be a different drug. We have to get off this profiteering track that has happened for too long, so we can make sure that people can afford their medication, that we're making sure that big pharmaceutical companies aren't lining their pockets at our expense, and that regular families aren't making the choice between paying their mortgage or paying for their medicine.
We hear about these costs of drugs, and it's not just anecdotal. We know that these costs have gone up, and most of us experience it in our own households. Fortunately, for most of us, it doesn't draw us to those kind of decisions to be made. As you try to regulate or try to somehow bring in the cost of these medicines, is there also a plan, a way to continue to encourage these drug companies to go for that next new thing? And we know there's a cost associated with that, because there are other medicines that can be developed that will help other diseases and other problems that we're facing. So you don't want to leverage one at the cost of the other, I assume.
No, that's right. And the assumption in that statement, though, is that the record profits from our pharmaceutical companies are somehow being then reinvested in research and development. And that's not necessarily the case. We see most of the research and development money that's being spent right now is then used to purchase or acquire other companies, a significant chunk of which is actually coming from basic research grants that's coming from our federal government or state governments and our universities. I mean, this system where we somehow publicize the risk, where taxpayers are paying for the basic research, but then we privatize those profits, and oftentimes at the critical health access of people who need prescription drugs. We got to fix this. I mean, that's why we're seeing this conversation happen in families and all across the country, really. At some point you reach a point, and my family's got stories like this where the prescription drugs that people have to take are more than the salary at which people are earning. And when we're talking about chronic conditions, when we're talking about needing access to life-saving drugs, we got to figure out how to move to a system that actually protects the health and welfare of the people of our state. The HOPE package is a place to begin with that. And it's part of the conversation that we have to have over the next year moving forward, so our healthcare system actually helps keep us healthy.
One of the things that has always been beyond explanation from my standpoint is what you were talking about re-importation of drugs. How a drug produced here, sold in Canada, can be less expensive than the same drug produced here and sold here. So that re-importation, would that be not only an issue of trying to allow people to bring those drugs back in, or would it also be leveraged to try to get them to match that price here in the United States?
When we remove an artificial barrier that's preventing these artificially high drug prices, then folks would have to compete and match those prices. I mean, it is interesting that we keep setting up all these different rules. So when we're looking at the way the capital moves, when we're looking at some of these other sort of import-export issues, that folks are oftentimes getting a great deal, except for the folks that need to take care of their health. This is an example where there are different rules for different people, and regular people are tired of playing by rules in which they're losing. I mean, right, we are watching seniors literally take buses across the border into Canada so they can get the drugs that are oftentimes produced here in America at a more affordable price. That's messed up, and that's a symptom of a system that isn't set up to serve the needs of the people that actually live here in Michigan, that live here in America. And so, we're trying to take some steps forward to fix that. And, I know we're going to be fought. I know that there are big pharmaceutical companies that are making a lot of money off this. I know that there are health insurance companies that benefit from the way the system is set up right now. But the truth is, people in America want to see something different. And this is some easy ways through the HOPE package that we could start on that process.
We have seen in this legislature a willingness to do something that many outside observers didn't think could happen, and that's redo auto no-fault insurance. We saw voters do something that you had talked about for a very long time in the last cycle, change the way redistricting is going to happen. So as an observer who thought neither of those things were very likely, this looks like a heavy lift. Do you think you have Republican support to go along with part of this?
So when I first entered in my third term of the legislature, you always have to get to know your new colleagues. And the number of people that had healthcare stories was incredible. People that were frustrated with the way the health insurance billing works, people that were sharing stories on long-term care, people that are sharing stories on prescription drug prices. I think when it comes to health, the pain is felt regardless of whether you're a Democrat, a Republican, or an independent. The solutions may differ, but with some of these issues, I hope that we can find common ground. Do I expect every bill in the HOPE package to pass? Perhaps not. But I hope that folks will talk to their legislators, because what we're talking about in this package of bills is a place to start a conversation, to bring some accountability to prescription drug prices, to increase access under a healthcare system that exists now so it's more affordable and more open to more people. And when it comes to some of the most high-profile issues we've seen related to prescription drugs, for things like EpiPens and insulin, we could at least say in Michigan, we're going to take some concrete steps forward. So I have some hope. But as with everything you've described, it took a lot of advocacy. So if healthcare, if prescription drug costs, if long-term care, an issue that we have produced bipartisan wins on, are important to you, then you have to let your legislators know.
When we come back, Republican Hoadley and Iden talks about an initiative that is far from new, but he hopes not far from done. That's next. To the Point. Welcome back to the Point. Earlier in the year, the legislature passed and the governor signed auto no-fault legislation that had been decades in the making. Sometimes it just takes time. Such is the case with our next topic. The idea of regulating online sports betting and other gambling is far from new, and Republican Representative Hoadley and Iden from Oshtemo hopes it's not far from becoming a reality. Representative, let's talk about something that I think people sometimes forget, and that is that legislation can take a while.
Yes, it can.
You've been working on something, not a singular item, but you've been working to deal with internet gambling, and I don't want to over-characterize it. Explain to me what it is you've been working towards, and then we'll talk a little bit about where we are, because I think we did this show maybe a year ago or more. We talked about this.
Yeah. So exactly that. I'm now in year 4 of working on a multitude of bills which deal with basically regulating the online market for internet gaming. And this involves fantasy sports. This involves traditional internet table games, blackjack, roulette, things like that. Poker would be part of that, as well as a big one that we've heard a lot about from states across the country, sports betting, which is big. And the impetus of this has always been to regulate a market which currently exists that is unregulated. And whether it's people making illegal bets online and not knowing about it, most of the time you can go to any internet web browser, type in Michigan sports betting or Michigan online gambling, and a host of websites will pop up that are all based in Dominican Republic or something like that that offer these services. People play. You go to a college campus. I talk to a lot of college students. You play sports bets? Oh yeah, all the time. How do you do it? Well, I do it on the internet. Well, you can do it on the internet. Well, did you know you're breaking the law? No, I'm not. And then you get back and forth, and then come to find out they certainly are. So the impetus for this has always been protect the consumers in the marketplace. And that's where I started with this. And it started before PASPA was repealed, before sports betting was allowed. And here we are today. Numerous states have come online with sports betting. Illinois, Indiana, Ohio's close, Canada's had it. And I've said, okay, for Michigan to be competitive, we need to involve ourselves in this market. Because now the secondary conversation is, what about the revenue to the state of Michigan? And so that's where we are in the debate today. We went through a veto with Governor Snyder, and now a year into Governor Whitmer's administration, we're still continuing the conversation and making progress slowly, but that's how the sausage gets made.
And you talk about the changes that happened since you started doing this. So, I mean, you obviously had to make some adjustments and may still have more. Are you at the point now where you see a vote and a resolution, or is this still the same process that's going to continue until you can get there?
Well, with term limits, I'm done next year, so we do have a finite amount of time to get this done. And I think we're working towards that goal. Obviously, the biggest crux in this conversation, the biggest sticking point that I've had with the administration has been on the tax rate. I started out with the internet gaming bill and sports betting at 8%. Governor asked for 15% on sports and 40% on internet games, which would make us the highest in the country across the board as it comes to this. And I've always said that doesn't make us competitive. If we want to get rid of the black market, we need to have a competitive rate. But I've also always said I'm willing to come off the 8%. And so what I believe is a fair compromise is to move the legislation forward at a higher tax rate, to make sure that we protect the school aid fund, which has been the governor's concern from day one, that this is going to pull money from the lottery, the online lottery that we have, which, by the way, is a monopoly by the state to control internet gaming. That's been the case. I made that case numerous times and just said, okay, we can still do this. There's a lot of money to be made on this for the state of Michigan. We can protect the school aid fund, bring these dollars in, and I think it's a win-win for everybody. So my goal is there will be a timeline. I would like to get this done by the end of the year. I'd like to have these bills on the governor's desk by the end of the year in a fair compromise manner that we can all agree on, because I don't want to do this for another veto. I've been through that process before, and I've said from day one, we're not doing this for another veto. It's an exercise, a waste of my time. So what we need to do is come up with a compromise on the tax rate, which I plan to do, get the bills on the governor's desk. That could put us in a position to be up to have sports betting in the state of Michigan as early as maybe the Super Bowl, or maybe by March Madness, which we know are huge times when people like to participate in sports betting.
A couple of quick things. One is the lottery and the school aid fund.
Yep.
I wasn't here when the lottery was voted on and passed, but if I am to believe people that I talked to, there was a real misconception that the lottery was going to pay for K through 12 education in the state of Michigan.
Sure.
Make the point that the vast majority, very small percentage for operating, comes out of the lottery. All of those dollars go to the school aid fund, but they're nowhere near the $14 or $15 billion a year that goes into that fund. I've done the story before.
Sure.
But you mentioned it, and I want to make that clear.
That is the case.
And so the revenues that would come from your bills would also go into the school aid fund.
Not as the bill's currently drafted. It sort of parcels it out. There's some dollars that go to problem gaming. There's some road dollars in there. When I started working on this, the roads conversation started then. It's ongoing now. So I inserted some, and then I also inserted dollars for education. But the one thing I've always said and been very consistent about is if the governor's number one priority is protecting the school aid fund and making sure that more dollars are available, we can direct those dollars there. And I've been committed to that.
One other final question about this, and we talked about this in one of our other earlier incarnations. There is also, and this is probably of lesser concern, but there is also the question of security online, because if you're doing something with a foreign entity and it's illegal in the state in which you're operating, you don't have much of a recourse if the folks from wherever don't send you your proceeds.
Absolutely none. So it's privacy is a big concern. First and foremost, you're just putting your information out there, social security number, credit card, and you're sending it to who knows where. My previous example, the Dominican Republic, someone's going to take this information in. First off, now they have all your information, which that creates a number of concerns right there. How are they storing this data? Who can hack their systems? Lots of questions there, but not to mention, let's say you win, and your point's exactly right. Now you get, I've heard stories of people getting a check from a Chinese bank of some kind. Well, how can they cash that? Their local bank won't take that, if they get paid at all in some of these cases. So it is about privacy, and really it comes back to protecting that consumer at every point, because another point to be made on that is, with the illegal market the way that it is, we can't protect underage people from playing, potentially. We can't protect people who have problem gaming issues. With the technology that we have today and in a regulated system, we can put in check stops for that. If you're, it certainly tracks how much you're betting on the internet through these websites, and through the casino is how these are operated, by the way. Casinos have these check stops to say, wait a minute, this person has a problem, gaming problem, they've identified that, they shouldn't be playing, and so there are real good protections that we can put in that help Michiganders. And that's been a case that I've also made to the governor, and I think that gets lost a lot in the discussion. When she just focuses on the tax rate, she forgets about all the families who are harmed by not addressing this issue in some capacity sooner rather than later.
In the time that we have left, you brought up an interesting issue before we started doing this, and that is an opportunity that could arise that will give some cities in West Michigan and perhaps on the east side of the state too, that currently don't have the ability to do an assessment that could lead to a very big change and what most people would consider an improvement in some of those cities. Talk to me about this effort.
Yeah, so I've been working on a bill for some time now, and we were able to move it out of the Ways and Means Committee just this morning. It'll now go to the House floor, where I believe it's going to receive broad bipartisan support, as it did in committee, both committees. And the issue is basically this. This is about an economic development opportunity for my community. Now, other communities have been brought into the bill because it's based on population size, but this basically would give the Kalamazoo County Commission the ability to institute an up to 4% assessment on the hotel bills for those people traveling to and from, in and out of a hotel in the Kalamazoo County. That money would then be directed to a fund which would go to help construct an arena event center downtown. And this is an issue that came up on the county commission when I was on it 10 years ago. There's been a number of iterations of how to pay for this, but this would be part of a public-private partnership. And again, this bill is not about constructing the arena at all. Even though I support that, and I've been very vocal about that, this bill is about giving the locals the ability to do this if the local board decides that they want to move forward. It'd be a great economic opportunity for, the bill would include Ingham, it would include Ottawa, Kalamazoo. I mean, this is an opportunity that exists in state statute, and I think it would really transform our downtown market. And I've always been supportive of any revitalization to the urban areas, even though I don't even represent downtown Kalamazoo. People will go there, people will go to the bars, restaurants, spend money down there. It'd be a fantastic opportunity, and I just want our county commission to have the same abilities that other counties have in the state. That's why we're working to basically amend the act.
And so it's an existing statute, you're just lowering the population threshold so it would include those other areas.
Correct.
Okay. And did you say earlier that there were counties on the east, like maybe Washington, some of those counties that had the
so it would also,
if they want to adopt
if they want to adopt it. Yep.
And so this is really a matter of giving them the same opportunities that a Detroit or Grand Rapids had previously.
That's exactly correct. That's exactly correct. And I think it'd be great for Kalamazoo.
So when you look at the limited days you have left in this session, you got to get that through the House, get it over to the Senate, I presume, and get it to the governor. Is that something that you can get done before you take that holiday break?
I'm also committed to that. I think that those are, both big items, but both wide bipartisan support on both of those issues, and I believe we're going to be able to get these on the governor's desk, and I think we're going to see support on all these items. It's going to take us a little bit to get there, and I know we do have limited days left, but I'm committed to getting these items done. So.
The process of getting legislation passed is, as it should be, complex, not always accomplished quickly. We'll follow both of these issues and let you know if they become reality. When we come back, what about the state budget? It's done, but is it over? Next, To the Point. We know in Lansing a budget has been passed, altered, and signed. The question now is, can legislative leaders and the governor recover enough trust to make some changes to the already enacted budget? The answer is yes, but will they? We don't know that answer. We'll keep watching. So far, we haven't seen much progress. But we'll see you next and every Sunday right here at 10 o'clock for To the Point.